Hello friends. In previous class we are discussed about the inflammation, 5 sign of inflammation and cause of inflammation. Today we are discuss about the types of inflammation, pathophysiology of inflammation, diagnosis and management of inflammation. So let's start the today class. Types of inflammation. Inflammation can manifest in various types, depending on the duration, characteristics, and underlying causes. The two primary types of inflammation are acute and chronic. Here's an overview of each. 1. Acute inflammation. Acute inflammation is a rapid and immediate response to tissue injury, infection, or trauma. It is a short-term process, typically lasting for a few days to a few weeks. Acute inflammation is a protective and localized response aimed at eliminating the cause of cell injury, clearing damaged cells, and initiating tissue repair. 2. Chronic inflammation. Chronic inflammation is a prolonged and sustained inflammatory response that may persist for months or even years. It is a long-term process and can contribute to tissue damage and progressive diseases. Chronic diseases such as rheumatoid arthritis, inflammatory bowel diseases, chronic infections, and autoimmune disorders are associated with chronic inflammation. 3. Granulomatus inflammation. Granulomatous inflammation is a specific type characterized by the formation of granulomas, small nodules of immune cells. Examples: tuberculosis and sarcoidosis are conditions where granulomatous inflammation is a prominent feature. 4. Serous inflammation. Serous inflammation involves the exudation of a watery, serum-like fluid without a significant presence of proteins. Examples: burns, allergies, and viral infections can cause serous inflammation. 5. Fibrinous inflammation. Fibrinous inflammation involves the deposition of fibrin, a protein involved in blood clotting, leading to a mesh-like structure. Examples: severe injuries or infections, such as pneumonia, can result in fibrinous inflammation. 6. Purulent, suppurative inflammation. Purulent inflammation is associated with the presence of pus, which consist of dead cells, tissue debris, and bacteria. Examples: abscess formation in response to bacterial infections is a common scenario for purulent inflammation. 7. Ulcerative inflammation. Ulcerative inflammation involves the formation of ulcers, characterized by the loss of epithelial tissue and exposure of underlying layers. Examples: peptic ulcers in the gastrointestinal tract can result from ulcerative inflammation. Understanding the types of inflammation is crucial for healthcare professionals in diagnosing and managing various conditions. Pathophysiology of inflammation. 1. Typically injury, infection, or irritation. 2. Release of inflammatory mediators, includes histamines, prostaglandins, and other mediators triggering the inflammatory response. 3. Vasodilation and increased permeability, blood vessels widen, vasodilation, allowing increased blood flow, and vessel walls become more permeable, leading to fluid and immune cell movement. 4. Recruitment of immune cells, neutrophils and macrophages are attracted to the site of inflammation to address the cause. 5. Phagocytosis of pathogens or debris, immune cells engulf and digest pathogens or cellular debris. 6. Release of cytokines and chemokines, signaling molecules that regulate immune responses and attract more immune cells to the site. 7. Activation of complement system. Complement proteins enhance the immune response by promoting phagocytosis and inflammation. 8. Formation of inflammatory exudate, accumulation of fluid, proteins, and immune cells at the site, contributing to swelling. 9. Tissue repair and regeneration, initiates the healing process, involving the removal of damaged tissue and the initiation of repair mechanisms. 10. Resolution of inflammation, successful completion of the inflammatory response, leading to a return to homeostasis. Diagnosis of inflammation. The diagnosis of inflammation involves a comprehensive assessment, including clinical evaluation, laboratory tests, and imaging studies. Here are key components of the diagnostic process. 1. Clinical evaluation. Medical history. Gather information about the patient's symptoms, medical history, and any potential triggers or exposures. Physical examination. Assess for signs of inflammation, such as redness, swelling, warmth, pain, and loss of function. Examine specific areas or joints affected. 2. Laboratory tests. Complete blood count, CBC, elevated white blood cell count may indicate an inflammatory response. C-reactive protein, CRP, increased levels suggest inflammation. Erythrocyte sedimentation rate, ESR, elevated ESR is a non-specific marker of inflammation. Serum biomarkers. Depending on the suspected cause, specific biomarkers may be assessed. For example, rheumatoid factor or anticyclic citrullonated peptide, anti-CCP, antibodies for autoimmune arthritis. 3. Imaging studies. X-rays, helpful for assessing bone changes, joint damage, or identifying calcifications. Ultrasound, useful for evaluating soft tissues, joints, and detecting fluid or inflammation. MRI, magnetic resonance imaging, provides detailed images of soft tissues and is sensitive to inflammation in joints and organs. CT scan, computed tomography, helpful for assessing inflammation in organs or structures not well visualized by other methods. 4. Biopsy. In certain cases, a tissue biopsy may be performed to examine a sample under a microscope. This can help diagnose inflammatory conditions affecting specific organs or tissues. 5. Specialized tests. Depending on the suspected cause, additional tests may be necessary. Examples include autoimmune panels, joint fluid analysis, or tests for infectious agents. 6. Endoscopy. In cases of inflammation in the gastrointestinal tract or other internal organs, endoscopic procedures may be performed to visualize and obtain tissue samples. 7. Functional tests. Assessing specific functions related to the suspected inflammatory condition. For example, lung function tests for respiratory inflammation or joint function assessments. 8. Genetic testing. For certain autoimmune conditions, genetic testing may help identify predispositions or markers associated with increased risk. 9. Clinical criteria. Some inflammatory conditions have specific diagnostic criteria based on clinical and laboratory findings. Meeting these criteria aids in confirming the diagnosis. 10. Response to treatment. In some cases, the response to anti-inflammatory treatment may serve as a diagnostic tool. Improvement in symptoms and normalization of inflammatory markers support the diagnosis. The diagnostic approach varies based on the suspected cause and the affected organs or systems. Medical management. The management of inflammation involves a multifaceted approach, addressing both the underlying cause and the symptomatic relief of inflammatory processes. Here's a detailed overview of the management strategies. 1. Identification and treatment of underlying cause. Determine and address the root cause, whether it's infection, injury, autoimmune condition, or other triggers. 2. Pharmacological interventions. A. Nonsteroidal anti-inflammatory drugs, NSAIDs. Reduce pain, inflammation, and fever by inhibiting prostaglandin synthesis. Examples include ibuprofen and naproxen. B. Corticosteroids. Powerful anti-inflammatory medications that suppress immune responses. Used for various inflammatory conditions but with potential side effects, especially with prolonged use. C. Disease-modifying anti-rheumatic drugs, DMARDs. Employed in autoimmune disorders to modify the disease course. Examples include methotrexate and hydroxychloroquine. D. Biologic response modifiers. Target specific molecules involved in the inflammatory response, often used in autoimmune diseases. Examples include TNF inhibitors like etanercept and adalimumab. 3. Analgesics for pain management. Use pain relievers like acetaminophen for symptomatic relief, especially in conditions associated with pain. 4. Rest and immobilization. Resting the affected area helps reduce inflammation, allowing the body to focus on healing. Immobilization may be necessary in certain cases to prevent further injury. 5. RICE. Protocol. For acute injuries, the rest, ice, compression, and elevation, RICE, protocol can help manage inflammation and promote healing. 6. Physical therapy. Exercises and interventions designed to improve strength, flexibility, and function can aid in managing chronic inflammatory conditions, especially those affecting joints. 7. Nutritional interventions. A diet rich in anti-inflammatory foods, such as fruits, vegetables, fatty fish, and nuts may help mitigate inflammation. Omega-3 fatty acids, found in fish oil, have anti-inflammatory properties. 8. Avoidance of triggers. Identify and avoid factors that may exacerbate inflammation, such as allergens, irritants, or stressor. 9. Weight management. Maintaining a healthy weight can reduce inflammation, especially in conditions like obesity-associated inflammation. 10. Stress reduction. Chronic stress can contribute to inflammation. Stress management techniques such as meditation, yoga, and relaxation exercises may be beneficial. 11. Smoking cessation. Smoking is associated with increased inflammation and can worsen various health conditions. Quitting smoking can have positive effects on inflammation. 12. Topical treatments. Topical creams or ointments containing anti-inflammatory agents, such as corticosteroids, can be effective for localized inflammation, skin conditions, or joint pain. 13. Biological therapies. Emerging treatments like cytokine inhibitors and targeted therapies are being developed for specific inflammatory conditions. It's essential to the management approach to the specific condition and individual patient needs. Consulting with a healthcare professional is crucial for accurate diagnosis and appropriate treatment planning. Additionally, long-term management may require periodic monitoring and adjustments to the treatment plan based on the patient's response and changes in the inflammatory condition.